These nerve roots branch into the nerves that travel into the upper extremities, upper body, and to certain organs. Ligaments are strong connective tissues that attach bones to other bones. Several long ligaments connect on the front and back sections of the vertebra. The anterior longitudinal ligament runs lengthwise down the front of the vertebral bodies. The posterior longitudinal ligament attaches on the back of the vertebral bodies. The ligamentum flavum is a long elastic band that connects to the front surface of each of the lamina bones. Each set of facet joints is also surrounded by a joint capsule that is made up of ligaments. A special structure in the spine called an intervertebral disc sits between each pair of vertebrae. An intervertebral disc is made of two parts. In the center of each intervertebral disc is a spongy material called the nucleus pulposus. The nucleus pulposus provides most of the shock absorption in the spine. The nucleus is surrounded by the annulus, a series of strong ligamentous rings that attach to the vertebra above and below the intervertebral disc. The anterior cervical area is covered with muscles that run from the rib cage and collarbone to the cervical vertebra, jaw, and skull. The posterior cervical muscles cover the bones along the back of the spine and make up the bulk of the tissues on the back of the neck. A good way to understand the anatomy of the cervical spine is by looking at a single spinal segment. A spinal segment includes two vertebrae separated by an intervertebral disc, the nerves that leave the spinal cord between each pair of vertebrae, and the small facet joints that link each level of the spinal column. The intervertebral disc separates the two vertebral bodies of the spinal segment. The facet joints and intervertebral disc work together to allow bending and rotating of the cervical spine. The facet joints slide while the disc works like a flexible connection between the two vertebrae. It is probably quite clear that the cervical spine is a complex machine with an important job to do. Understanding the structure and function of the cervical spine can help you better understand how problems in the neck can cause pain and dysfunction, enabling you to become more involved in your health care and better able to care for your neck problem.